Guys, welcome back to Medical Coding with Blue. Today's episode is all about how to prepare yourself for the AAPC CPC fill-in-the-blank exam. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so if you are preparing for the AAPC CPC exam, which the articles that I have read have said that beginning in 2024, that will be part of the exam will be fill in the blank. And that means looking up the codes and filling in the blanks. So here's the thing, guys. I don't have an exact date on when this is going to happen. All I have heard is from the people that have been asking me about it, the articles that I've seen. I still have not seen the date on those. They just said 2024. We are in 2024 currently. So I don't know when they're going to start that type of exam. But if you are practicing right now for your exam, you should be preparing yourself anyway. And one other note aside, this is not carpal tunnel. This is an injury. Okay, I'm just saying that in case nobody's been around lately to know what this is about. It's just an injury. So the other thing that I want to say is this. If you are sitting for an AHIMA exam, this message is for you as well, because even though the exams are different, every association has different exams, and AHIMA is different. You can look on the AHIMA website for theirs. The real world is not multiple choice, okay? So actually, anybody that is preparing for a medical coding certification exam should be already knowing how to fill in the blank. They should already know how to not have to use multiple choice in order to get the answer, because again, that's not what you encounter in the real world, okay? So that's something that you all should know right up front. It is scary, especially if you've gone through a fast-paced medical coding program, or maybe they sold you at the school, oh, well, we'll have a teacher, and the teacher really didn't help you. There are many ways of getting practice on your own, but you also have to be engaged in the practice. No one can make you practice. And there are people who do study groups. Some are successful. A lot of them are not, because of the simple fact that there's always going to be those people that want people to kind of carry them through. In medical coding, you have to carry yourself, which is what runs off a lot of people, okay? So if you are truly serious and you want to prepare yourself and you say, well, Blue, I'm really scared, but I want to be prepared when I go in to take my CPC exam, and I don't want to have to feel so scared when I'm doing those fill in the blanks. This message is for you. Okay, so here we go. Now, when it comes to how do you get practice, the practice that you're already doing in the CPC study guide, you can do on your own. So for example, you want to cover up the answers on the multiple choice, and you want to go ahead and look up the codes based on the scenario by itself. That way, you're not giving yourself that opportunity to go through multiple choice type deals. You are learning how to look things up in the book yourself. If you are using the book, which you should be using your book, there's too many of you out there that I see that you get real gung-ho about, I want to tab all my books and write and highlight and do all this stuff to it. You don't need to, guys. The book has the answers. All you have to do is learn to use the book. The people who learn to use the book are the most successful on these exams. It's those ones that are looking for the shortcuts. What do I have to know? And what do I have to write? What do I have to highlight? What do I have to tab? And how do I have to tab? Those are the ones that are spending so much time doing other things except for the most important thing, which is the critical thinking and the practicing of how to look up codes in the book. That's where it all is. It's not a big secret, guys. It is actually practicing looking up codes in the book. But again, there's too many of you out there wanting to tab, write, and highlight and do all that garbage to your books. And don't write me saying that, oh, that's how I learn. These are not workbooks. The coding manuals are not workbooks. That's why you have workbooks, so that you can write in those. You can write, tab, highlight, do all kinds of garbage you want to that book, because that's a workbook. The coding manuals, you have to take the time to get to know them. And believe me, guys, it is possible to learn to use your book without the tabs, because I've done it. when I came into the industry, it was very strict back then. It was in 2008 was when I took my exam. So I was in school in 2007. And when I was taking the exam, they said you could not have any tabs, no writing, no highlighting, anything in the books at all. So they wanted to make sure that all the books were clean, even if the tabs came with a book. Now, they've relaxed it a little bit, AHIMA has. And if the tabs came with the book, you can use those. So the CPT Professional Edition does have its own original tabs. You can use those because they came with the book. And those are the ones that have like the stickies. So, you can use those. I've demonstrated how to tab it a few times on the channel. I don't like doing that episode, but it's only because I get so many people asking me to demonstrate. That's the only reason that I do it. But guys, you can learn to use that book without the tabs. And it's actually better and much more easier and faster to get through the book. Once you get past like the first few days where you're trying to learn the book, you'll start learning it a lot faster and you won't have to rely on those tabs. I'm just saying, that's just my advice anyway, guys. What do I know? I've only been in the industry since 2008. I've only had 3 certifications. I started off with the CCA, with the HEMA. And then in 2021, I got the CCSP, the Certified Coding Specialist Physician Based. And then as soon as I got that credential, it superseded my CCA. So I only had 1. And then later that year, I got the CCS, the Certified Coding Specialist. So, I mean, guys, I know what I'm talking about. I've trained many, many people about medical coding. So when I tell you and I advise you, it's coming from a place of experience, okay? And actually being in the field. Because there's even teachers, instructors at the schools that have never really coded in the field because they couldn't keep up with production, or they just didn't like the pressure of, having to do all of these things when it comes to the coding. So they instruct, but they basically proctor from a book. That's all they're doing. So with that said, keep this in mind, guys. When you are practicing with your books, it's making you sharper. It's making you more prepared for the real world. Instead of running around asking questions, how do I do this? How do I do that? Open your book. Open your book. Cover up the answers and work them out. And then when you are reviewing your answers versus the book, and you see, okay, well, I'm missing this one. I didn't sequence this right. Or, I forgot to add this code, or it was completely in left field. That is going to help you to know how to narrow down how you need to study. Because if it is like a sequencing issue, you can go back to the coding guidelines for that. If it is that maybe it's mother baby and you're forgetting certain codes for mother baby, then that's when you need to concentrate on that. So that's a way to kind of help you get used to that and get kind of over that fear. Because a lot of times people will be fearful of this industry and, I just want to learn just enough just to pass so that I can get a job and then I can learn in the real world. No, you need to be actively preparing yourself now. If you are not actively preparing yourself now, you are setting yourself up to fail. This is your journey. And when it comes to the readiness that you have when you go out in the real world, they are going to test you. And again, those employers are not going to give you multiple choice tests. So stop running around saying that you're afraid because it's a fill in the blank. If you're practicing like you're supposed to, you won't have that issue. You'll be able to walk in there confident and, okay, I can get this. As long as you're studying 20 hours per week as well. And I don't want to hear excuses, guys, because all it is excuses. Well, I have a family, I have a 40-hour-a-week job. Guess what? On my channel, I get mail and messages all the time from people. And a lot of these messages talk about all the things that they do and how they still make time and how they're thankful because I told them about studying 20 hours per week because they didn't know how many hours should they study, what was too little, what was too much. Okay. And once they got onto that 20 hours a week, then they were like, okay, this works. And that consistency is what helped them to do well. And it can help you do well too. You just have to follow it instead of trying to resist or make excuses, because it is hard to stay motivated when it's not fun, right? When the work is not fun, and when you're looking up codes and you're not getting the right answer and you're getting frustrated, that is when it's not fun. And that's when it's really easy to give it up. But you don't have to. You do not have to give it up. All you have to do is say, okay, I know if I got this part wrong, it's because of this. And then if you absolutely do not know how to look up that particular code or that particular scenario or whatever, then make note of it and then look at the answers and then reverse teach yourself. Go to the answer key, go to that answer, go look up that answer and try to get it where it's like, okay, you're going to like word associate certain words so that it makes sense. The first couple of times you do it, you may still be a little lost, but after you keep doing it, that's when it's going to make more sense. When I was preparing myself for the CCS exam, CCS says you have the mastery of the outpatient and the inpatient side. A lot of people erroneously say, oh, it's only the mastery of the inpatient side. Little do you know. Okay, little do you know. Okay, because it's both. Outpatient and inpatient. Mastery of both, all right? And because of this, when I was preparing for it, okay, I was like, okay, well, I have mastered outpatient, but I need to work on that inpatient side. I've never coded in an inpatient side before. I've done professional fee where the patient stays on the floor and the doctor, I'm sure the doctor gets paid. But as far as doing for the facility, I had not done that yet. So I knew I had a lot of practice to do. But even though when I was preparing for the test, I was like, okay, I have no experience with this, but what I do have is the book. And the Optum book, if you, it's not an ad for Optum, but if you have the Optum ICD-10 PCS book, right? If you have the spiral bound version, in the back in Appendix M, there is 388 procedures that you can look up. And that's exactly what I did. I looked up all of those procedures so that I could get the practice. Oh, because trust me, when you do that practice, you will be ready. You will be ready. And there's nothing that you'll be fearful of because you've gone through all those paces. Appendix M is wonderful in the spiral bound book. Do not get the flat edge book. I'm just saying because the flat edge book does not have that quiz in the back, the 388 procedures. It doesn't have it in the ICD-10 PCS book, okay? The one with the flat edge. It has to be the spiral bound. And it does have the rationale. So that kind of helped me because some of those things I was like, what is this? How would I do this? But had I not been practicing, I know I would have been fumbling through that book. And everything is about speed and time when you are in those exams. You can't BS your way through the whole exam, okay, guys? There are some people that say, well, you can use process of elimination. Process of elimination will only take you so far, but your ability to not really understand what you're doing is going to show when you're out in the real world and you're trying to get a job and you can't pass an assessment test because you don't know the basics of coding. And the basics of coding is right there in front of you based on just opening the book and looking through the pages and looking up the codes and getting familiar. Like I said, a lot of people want the big notes. Oh, I want big notes, big notes. No, you ain't getting no big notes. You know why? Because if you can't look up the diagnoses by themselves, if you can't look up 1 line, 2 lines, if you can't look those up, what makes you think you can spot diagnosis codes when you're looking at a note to even begin with? That's why, even on my Patreon channel, that's why I do that, because I want people to be able to spot that. If you don't take advantage of that, that's your hard luck. Because of the simple fact that even though it doesn't make sense to you, and you may think, oh, this is what you need, you're wrong. Because when it comes to those building blocks in coding, everything matters. The details matter. If you do not select the correct diagnosis code, there's a good chance you're not going to get the correct procedure code. If you don't get the correct procedure code, you may end up messing with that money for that provider that they should be getting because you got the wrong procedure code. You either going to make the patient pay too much or pay too little. The doctor's either going to end up having too much money and they're going to have to give it back plus a penalty, or that, it's just a bunch of things. So you want to be as accurate as possible. And going through each and every single one of those things is what you have to do. But standing around and questioning and what do I do and where do I go and I'm so panicked, that does nobody any good. So for all the times you feel like you're going to start doing that, you get that book and you can see it right there in the back. I'm not going to show it because I don't want to hear it, guys. Every time it's backwards. I know it's backwards. It's my phone. What do you want me to do? So get your CPC study guide. I still recommend that even for the AHIMA people that are taking the AHIMA test, because we all use the same CPT code set. And for the most part, by and large, AAPC got that CPC study guide right. It is very simple, straightforward. I love the way that it's broken down. There's a couple of the codes I don't agree with. But again, for the most part, it's a really great and fantastic book. I even used it to help me to prepare. Okay, and prepare on certain areas where I don't code that every day. I don't code in cardiology every day, but I did use that book to help me kind of get through. And there was a few other specialties that I don't do on a regular basis, or I don't see on a regular basis. So I did go through those practices to help me out. So that's just something that you can do, guys. Cover up the answers. Don't use those multiple choice. And even if it does have the option of multiple choice, cover it up. So that way you can see how closely are you finding those answers. And guess what happens, guys? The more you practice it, the faster you're going to be looking up codes. Because right now, you don't have to, when you're preparing for the test, you're not preparing with speed in mind. The speed will come over time, right? But the speed, when you're preparing for your test, will happen later. Right now, you're just practicing because you need to learn to look up codes in the book. But you need to learn to do that quickly. Because again, there's not going to be this crutch that you're going to be able to have to help you when you are looking up these codes for these ones that are fill in the blank. Now, I have guesstimated that they may have the number of codes. I don't know. I mean, they may not. I don't know. I'm thinking that they'll have like, okay, if it's 4, there's 4. I don't know, guys. I don't know. But I'm just saying that may be an option, But again, the whole test is not going to be fill in the blank. Okay, so just relax there. All right. You will still have multiple choice, but in order to get through those ones that are fill in the blank, you need to do it as quickly as possible. And the best way to prepare yourself to do that is to actually practice. And the more you actually practice, guess what happens? That stuff that's in the multiple choice part, that's going to come a lot faster to you because you're going to start recognizing those codes. Oh, this series belongs to this and this series belongs to this, and I can whittle this down really quick. And it'll be a lot easier to do your process of elimination if that's what you're doing. Okay, so that's the thing that you guys need to think about. Practicing with the books is a very good thing. That is the thing that is going to save a lot of you. And it's actually going to be the thing that's going to get you, it's going to be the difference between you getting hired and you not getting hired. Okay, because I've seen a lot of people who say, well, I finished the school and I still can't find a job. And then when I asked them, when I started probing them a little bit more deeper, and then they say, well, that they can't pass the assessment test. And guys, if you're not passing that assessment test, there's literally no excuse, especially if you've passed the certification exam. If you pass the certification exam, that means that you can pass the assessment tests. All you need to do is get back into practicing with the books and take 30 minutes at a time to start looking up codes. And then the more you do that, the more you'll get faster with it. And maybe the first time you may only get through 1 or 2 questions. But the more you do that, the better off you'll be. 30 minutes minimum, 1 hour maximum. It doesn't have to go past an hour, because if it does, you're going to get tired and you're not going to want to do whatever that is, whatever ones you're looking up anyway, you're not going to want to keep looking them up. Okay. You have to give yourself a break after 1 hour. I found that to be very true when I was practicing for the CCS exam, and I was going through the ICD-10 PCS part again. I was just like, oh. And once I got to past an hour, because I just kept going, I'm like, why do I keep getting these wrong? It's because I was tired after 1 hour, because you get tired like that. But again, when you're first starting out, you're going to go slow and then you're going to go faster. But you have to practice. You can't BS your way through those fill in the blank ones. You can't. And you have to be able to get that practice in. If you're not practicing, that's literally all medical coding is. It's literally all it is. And yes, there is the encoder. Yes, there will be things in the electronic health record to kind of help guide the code selections. However, it's not always correct. And for those of you who are just blindly going along with it and saying, oh yeah, that's it, that's what it is. No, a lot of times those codes are wrong. So you want to make sure that you are actually practicing, so that way you don't have to rely on technology to do all of those things. Some people actually speak to me like they know better than I do, especially some new people. And it's just like, okay, but they go, well, no, I want to get really proficient with the encoder. You can't get proficient with the encoder if you're not proficient with the books. Can't do it. I mean, you could, but what happens? A lot of times you still have to know, when you're going through the decision tree in the encoder, you still have to know which path to go down. And that's not always the easiest thing, especially when it starts asking you like specific things, okay? Like the breakdown of whatever it is. You have to know these things. And if you don't know these things, you're going to go down the wrong path. And guess what? You're going to get the wrong code. Really easy. So again, if you're a brand new coder, don't waste time trying to be so proficient with an encoder that you don't even know if you're going to be using that particular encoder when you get in the real world. Because some places don't have encoder. Some other places do. They'll be like 3M or, whatever. And so, but again, it just depends on that organization. But you don't want to waste time when you've got your books. And these books are going to be here to stay, where, you're going to have them for reference. That is just the way that the industry is. There's a lot of things that come out every single year, new procedures, new equipment, new diagnoses, more specified diagnoses. There's a lot of things that happen every single year. And because of that, these code sets are always going to expand. They're always going to change. Not drastically some years, but sometimes it's going to add on more or add on just a few things or take off a few things. So again, being very proficient with the book is going to help you. But that's my advice for how to prepare yourself for those fill in the blank. Get the workbook, cover up the answers, the multiple choice, and practice that way. Find out what you're missing. What are you missing when you are looking up these codes? And if it's the sequencing, think about the sequencing, okay? Is it sequencing? Then you need to review your guidelines, all right? And it's only meant to help you guys. That's the only reason that I have my channel, is to help y'all, okay? If you take my help, great. If you don't take my help, you can lead a horse to water, but you can't make it drink, okay? So with that said, I'm going to go ahead and wrap this one up, and I will see y'all next time. If this video helped you, please like, subscribe, and share, and I'll see y'all again. Bye.